This is going to be my video validation for the Enema part of the skills. First, what you're going to want to do is, again, make sure that you have your 5 rights. You're going to want to make sure you have the right drug, route, patient, time, and amount of the drug that's being administered. This will be your first of the 3 checks that you're going to do. So I'm at my nurse's station and I check that I have the right drug in the patient's record. I have the right route to administer, which in this particular case is through an enema. And I have the right patient that I'm looking at, and then I have the right amount of liquid that I'm going to be using, and I have the correct time. So at this point I'll gather my supplies and then go into my patient room. At the patient's bedside, I would do my second patient check. I would make sure that I have the right patient, the right time, the right drug, the right amount, and the right route. I'd have my MAR or my physician's orders with me, and I would check it against that I have everything correct. And then I would come into the patient's room, identify them via their armband, and I make sure I have the right MRN, right patient, against the MAR that I have and the patient that I'm looking for, and that's correct. I would explain to the patient what procedure I'm going to be doing. I'm going to be administering an enema. Enemas are basically used for patients that are having trouble using the bathroom, that are constipated, and they need help getting fecal matter out. I would ask the patient to lay in the left Sims position. And at this point, I would do my 3rd check to make sure that I have the right patient and the right amount, the right time, right drug, and that's all confirmed at the 3rd time. So I would now get ready to do my procedure. I would wash my hands first, apply gloves. I would get my enema bag out. I would fill it with the correct amount of solution that's needed, that's ordered by the physician. I would apply lubricant. Making sure not to get it on your gloved hand. And you'd want to insert the tubing into the anus about 4 inches. It's probably about that much. You would ask the patient to take a deep breath, and you want to insert it about 4 inches. You would also want to make sure that you have a commode or a bedside toilet of some kind nearby, because a lot of the times you'll administer the enema and then shortly after they'll need to expel. You'd want to administer the fluid in the bag over about a time of 5 to 10 minutes. If the patient expresses any discomfort, you would want to slow the fluid entering the body until they feel like they don't have to expel anymore. And then you would want to keep the fluid going at a slower rate for about 5 to 10 minutes. You would, after the time is up and you've either administered all of the fluid needed or the patient doesn't think that they can handle anymore, you would ask them to take a deep breath and remove the tubing. And then you would want to let them know that you probably want to get up and be close to the commode, because you're going to have to go pretty soon probably just to expel that fluid. You'd want to get rid of your supplies correctly in the correct receptacle. And you'd want to remove your gloves and do hand hygiene and check on the patient after a few minutes just to make sure that they're still comfortable.